Thank you very much, Valentina. And it is great to see such a big turnout of people. I think everybody is totally exhausted with Zoom meetings and all of the virtual connections we have to make. But somehow, maybe with this Network O group, we're so used to seeing each other in person and reading each other's work that this might be an exception to the rule where people are willing and anxious to be part of this GVC series. And many thanks to Valentina and Rory and Cornelia and Tim, the coordinators of Network O, for setting this up. And I think we'll probably have about 4 or 5 sessions. You'll hear more about that at the end. So as Valentina said, the goal here is really to start to create some research discussion. So what I would like to do in my opening remarks is address this topic of the impact of COVID-19 on global value chains as ongoing research. I've written a paper that's in the background documents for this session. Many of you I know are also working on this topic. So what I would like to do is try to raise the kinds of questions that I think GVC analysis can provide some interesting insights into in terms of how COVID-19 has affected medical supply industries and some of the debates that are going on. And then when we open it up for more general discussion, I think that there's going to be a lot of other country experiences and ideas of how to analyze these topics that hopefully you can share with us. And if you raise questions at the end, I'll try to come back and address some of the questions and follow up perhaps by email with things that come on the chat room. So the agenda that I'd like to cover is laid out on this slide. First, just to recognize, and on each of these topics, I'll have a few illustrative slides, that this COVID-19 global pandemic is really a twin crisis. It started out as a public health crisis because of the rapid dissemination and virulence of the new coronavirus, but it very quickly also became an economic crisis because economies had to close down as they were trying to respond to the public health crisis. And that's created an almost unprecedented set of disruptions to our daily life. We all know from universities how schooling has gone online and every other line of work has been affected. So it's an unprecedented crisis that has raised a lot of interest in the global supply chain aspects of this. So I think there's a few broad ways we could talk about supply chains, and I'll list them. But it raises a series of GVC topics. So the topics that I'm going to quickly cover, I want to cover this issue of personal protective equipment, since that's where some of the shortages were most acute, things like face masks, gloves, testing kits, etc. Then I want to go to China's response to some of these crises, because China has been the #1 supplier of a lot of personal protective equipment relevant to COVID-19. I'll talk about China's particular edge in terms of its scale-up capacity and the role of the state. And then the next few examples will deal with the US case, where the US has had major supply shortages in PPE like face masks. And I'll make an argument that policy failures were much more significant than market failures to explain those shortages. But the US has also had some supply gluts, where it had a shortage in something like ventilators and it tried to ramp up production. And it turned out it completely missed the mark in terms of what was needed. So we have both shortages and gluts to account for from a supply chain vantage point. I think the current topic that everybody is very interested in has to do with the vaccine rollout and how we measure that. I'll give you my impressions from the US case. And then finally, what does all of this experience mean in terms of what more resilient supply chains might look like in the future? I don't think we will return to any kind of pre-COVID-19 crisis normal. Whatever is going to happen in the future is going to be very different from what we saw in the past. So this is an agenda. I'm going to try to go through it quickly and just with some illustrations. And since I'm focusing largely on US and China, I really welcome alternative perspectives on those countries, but especially other country experiences and regional experiences with regard to the crisis. All right, so in terms of the idea of this being a twin crisis, public health and economic, just a couple sort of really alarming statistics. In terms of the global health crisis, now we've had about 100 million cases worldwide, and about over 2 million deaths. And the US, unfortunately, is in the leading category in terms of deaths coming out of this. So the health crisis is not only large, but it's continuing to escalate. And that's been one of our biggest problems. And the economic crisis, as we know, is that virtually every region and country in the world has been affected, with national economies locked down, soaring unemployment, and little or no income. So I think the logic here has been that once we had the coronavirus spread around the world in a matter of 2 or 3 months in early 2020, that led to economy-wide shutdowns. Industries were closed, people were told not to go to work, which created demand spikes for certain products that were needed to deal with the health crisis, which led to a series of supply shortages, and not just for medical products, but for food and other items. So the spillover of these supply shortages has been really striking beyond the medical industry. This is just one of many graphs we could see about the trajectory of the COVID-19 death tolls. But I think what's maybe most striking is in April, we had this initial spike of number of deaths worldwide, and then things really tamped down towards the summer. And I think there was some expectation that maybe as we got into warmer weather, countries would begin to control this. But then already in July, we had another spike here. And then unfortunately, in the last few months from October on, we've seen a soaring again of coronavirus cases. So this has been an epic problem, not just in terms of the severity and the number of countries affected, but this sort of roller coaster and ramp up, so that we still don't have it under control. And it means whatever adjustments we're making to supply chains, public policies, et cetera, have to continue. And we have to keep trying to learn from each other's experiences around the world. So I mentioned that there's 3, I think, broad explanations for supply chain shortages. And I think initially around March, when people began to see some of these shortages in areas like medical supplies, but also food, this topic of global supply chains all of a sudden became public topic number 1. Everybody discovered these global supply chains if they didn't know they existed, and not even global supply chains, but domestic supply chains. This idea that production isn't integrated in one place by a single set of companies, but we have a lot of inter-firm transactions, and logistics companies are a very important part of that process. So we have companies that make goods, companies that ship goods, companies that are buying them, companies and agencies. So one type of explanation that I think came out early when people began to notice, why are we having shortages of fresh produce and dairy and eggs and toilet paper, was kind of a logistics approach. That all along, we've always had 2 different distribution channels for many goods, most consumer goods. One is the retail distribution channel that a lot of us are familiar with when we go to stores, supermarkets, department stores, online purchasing to buy things as individual items. But there's this other wholesale market that's directing supplies to restaurants and schools and larger institutions. And one of the most dramatic stories that emerged in the US was articles where you would see farmers plowing under fresh produce, and millions of eggs being destroyed, and milk being also put to waste. And the question was, how is it that we've got this wholesale wastage of products, but we've got retail shortages? And what started to come out in the literature is two different markets, two different sets of companies. And because the coronavirus had depressed demand so much in different parts of the economy, schools were closed down, factories were closed down, et cetera, the wholesale market began to collapse. And when the wholesale market collapsed, we began to get retail shortages. So that's one kind of explanation that's very logistics oriented and relevant to GVC analysis or global production networks. We understand wholesale retail channels of distribution, but I think that brought a lot of topics into sort of a new view. A second approach, much closer to, I think, a lot of our GVC literature, has been the supply chain structure approach. This idea of rigid versus resilient supply chains. And when people began to look at the market or the supply chains for, let's say, personal protective equipment coming into the US, like face masks and surgical gloves and gowns, they began to realize that this was a market largely centered around Asia. It was an Asian production hub for the entire world. And that was a very efficient, cost-driven, optimizing kind of structure that worked very well when demand was fluid and relatively high. But when we began to get the disruptions caused by COVID-19, those supply chains began to break down for various reasons. Part of which is that demand for these products multiplied 10, 20, 50-fold. The countries that were producing these goods were also being affected by the economy slowdown. So this started to create a much bigger debate about rigid versus resilient supply chains and how we need to adjust in the face of crisis. So that's another kind of approach, and I'll mention some things about that I think is relevant. And that's going to raise questions about what resilient supply chains look like in the future. How do we deal with post-COVID sort of topics? And third, and maybe not as well appreciated early on, but very important now, is the role of the state approach. The role of the state has always been an important part of, let's say, global production network analysis and some aspects of GVC analysis. We've always had a public policy backdrop to a lot of our studies. We've assumed certain policies were in place, and if those policies like multi-fiber agreement and apparel got changed, then we expect the supply chain structures to change along with it, or you get various kinds of trade restrictions. We have to analyze that. But by and large, for large periods of time, the policies were very much pro-growth, pro-trade, pro-investment, et cetera. But in the case of a country like China, which has become a dominant player, China has had a much bigger role of the state in terms of its development strategy and how it organizes and orchestrates its supply chain. So this becomes a very relevant factor in understanding China's response to the crisis and how it rebounded. But I think as we start thinking about vaccines, for example, the role of the state becomes very important everywhere. All countries are trying to figure out how do you deal with the distribution of topics like vaccines. So I think these are kind of three broad approaches that we should distinguish. We could use some of each of these depending on particular topics we want to analyze, but I'm particularly interested in the latter two for the rest of what I'll be talking about today. And then I mentioned that there's lots of ways that we can use GVC analysis in talking about different parts of the medical supply chains or the medical supplies industry. And one thing we know from GVC analysis is that oftentimes we have to become very product specific to do a good job. There are so many studies on just iPhones and how the iPhone's value chain works, or travels of a t-shirt in the global economy to go to the other extreme, simple products, complex products. And so it should come as no surprise when we're looking at something like how are medical supplies being affected by COVID-19 and what can we learn from a GVC approach, we have to pay attention to sub-markets or sub-segments of the medical supply market and specific products. So here's just an illustration of some of the themes I've been looking at, and I know a number of others have as well. Just in terms of medical supplies generally, we have one big distinction between personal protective equipment, which are relatively low-tech items that are being used regularly in the medical and construction industries, things like the face masks and catheters and needles and other gowns and gloves. But we have another category of medical supplies, much more sophisticated, that we put in the category of medical devices. ventilators are one example, but lots of other more sophisticated medical devices. We had two totally different global value chain networks for those two products. The personal protective equipment products are mainly concentrated in Asia. The medical devices industries are mainly concentrated in advanced industrial economies. And there's advantages, there's reasons why we see that segmentation. When we get into something like face masks, which is what I focused that article on, which was the background piece for the talk, surprisingly, and this is another, I think, regular insight of GVC analysis, even though face mask is a simple product overall, and it's a very inexpensive product, there are certain high-tech aspects of face masks, such as the way the filters are made. And if you don't get the high-tech component right, you can't make the finished product. And that's become a critical issue in terms of China's advantage and US failures, and I'll talk about that. Ventilators, on the other hand, it's one of those higher tech items. You know, face mask has about 665 parts. A ventilator has anywhere between 450 to 650 parts. And we know the complexity of finding out who's going to produce each of those parts and how they're coordinated. And ventilators was a really big focus in the US because people were dying, not having access to ventilators in the early months of the pandemic. And there was a huge effort to ramp up production. And later that turned out to be kind of disastrous because we ended up with a huge surplus, unused. Vaccines, I think, is the big story today, and we maybe all have a lot of perspectives on it. But from a supply chain point of view, to me, the critical thing about face masks and ventilators, there was a big focus on the production aspects of GVC analysis. But for vaccines, much more important has been the R&D side and the distribution side, the pre and post-production aspects in terms of what a GVC analysis can contribute. And then when we get to more resilient GVCs, it's going to bring up a lot of topics, but I'll say one thing up front. Some people have been saying because of this disruption and shortage, there's going to be a big push towards reshoring a lot of this production, bringing production from the Asian hubs where it was located back to US or Europe or Japan or other places. And I think that's not likely to happen in large scale. There will be some reshoring, but it's going to have to be very selective. And so we have to, again, use the GVC logic to figure out what we think more resilient supply chains are going to look like in the future and how they're different from the pre-pandemic supply chains of the past. So now I'll just go through with some illustrative slides on these points, just to give you a flavor for the kind of information that's out there. So this is a really nice slide from an OECD study that I think shows a range of COVID-19 goods. And there's actually a lot of trade projects that are just tracking COVID-19 goods, like the ones on this map. I mean, it's become its own industry category. What products do we need to use in treating patients? And you can see on this partial map, there's a mix of low-tech items, relatively low-tech, in which Asian countries predominate. So the face masks, bed sheets, non-woven protective garments, surgical gloves, etc. But there's also much higher tech items here, patient monitoring devices, the ventilators, specialized kinds of masks where we see Germany, US, Japan, Switzerland, the Netherlands coming into play. So key thing we have to keep in mind is these medical supplies are two big categories of products. One category, which are relatively low tech, which are Asia centered, and another category, which are much broader, but more advanced industrial country centered. And in some of these medical devices, Singapore is a big player, Ireland's a big player, Mexico happens to be a big player, but so are Switzerland, US, Germany, and a variety of the other developed countries. So it's not a single market. When we look at the PPE, and I'll just focus on personal protective equipment because I want to talk about face masks, we see China's a major player. China supplies about half of all PPE for the world, both US and EU. But when we get down to very specific products, we see a lot of variation. China's the biggest supplier in protective garments or certain kinds of respirators and surgical masks. But when we get to things like hospital gloves, Malaysia is a leading supplier. and we get to other kinds of products, Mexico's a leading supplier. So China's big and important in a lot of items, but other developing countries are important as well. So if we say, why does China dominate PPE exports? I think it has two really big advantages. I mean, one, it has low cost, based on a large and highly skilled manufacturing workforce, but it's also got unprecedented scale-up capabilities. When there are shortages, China has an ability to increase production, as we'll see in a minute, that no other countries or regions can match. And another important part of PPE, when people all of a sudden in the US become very surprised, well, why is it that so much of this production is concentrated in Asia? And why does China and India have the vast majority of generic pharmaceuticals, et cetera? We have to go back and do the history. That evolved over 10, 15 years, but it evolved partly because international business really preferred just-in-time production and purchasing. And Asia was really the best place to keep costs low, but have maximum capability. So let me just jump into one of the products we're talking about, face masks. Even in a single product like face masks, we have to do product differentiation. We've got surgical masks like these ones over here that are the 3-ply filter. And we've got the N95 masks, which were much more sophisticated. They're used, and in most times, normal times, only about 15% of N95s were used in medical use. Much of it was construction related and other kinds of industrial use. So when we look at these, surgical masks are sort of loose fitting, easier to make. N95 masks had much more protective properties in terms of filtering, but they all have to have filters. And the key point was they were all cheap. Even the N95 masks were less than $1 each. And even now they're back to about $1 each in the US. So these weren't expensive items, but they were critical from a health point of view. Back to the kind of high-tech input, the main input in face mask production were these non-woven polypropylene filter fabrics that were used in a lot of other products, baby diapers, disposable wipes, etc. And to make that, you had to have a particular kind of melt-blown process that could create filters that could trap all of these virus particles. So there's this really neat article that's referenced here that has a lot of pictures. I'm only showing two of them. The microscopic view of the face mask, where you can see that part of the way the face masks work is that you have these really small fibers made of polypropylene that are melt blown so that they're in random patterns. And then they also have an electrostatic charge that allows them to actually trap these virus particles. So even though the face mask looks really simple, and even though this material can be mass produced, making this melt blown fabric is high tech, and only a handful of big factories around the world produce this at scale. So I want to get to the China question, why China was so special in this. When China, we know the virus emerged in Wuhan, and in the first couple of months, January, February, early March, China was coping with its own outbreak of cases, and it tried to restrict exports of things like the mask. But I'm going to just give some quick statistics on China's scale up. China's surgical mask production increased 12-fold in 1 month, February 2020, from 10 million to 150 million masks per day. From March to May, China exported. Now, once it got its own production by March, China resumed its export of masks that had stopped. It exported in those 3 months 70 billion masks, which was more than triple world production in all of 2019. So think about that scale up. In 3 months, China is producing more than triple world totals the previous year. Number of Chinese companies making face masks, 67,000. But a handful of them are really big, and that's important. And even the mask making machinery comes from Asia. So, that melt blown fabric in particular, China has used, is now making 150 tons a day. This was from a report in July, so this was around April, May. That was five. So by April and May, China had increased its production 5 times over what it was doing in the end of 2019. And this is 15 times the total output of all US companies making this. So again, China's got an ability to make and ramp up production that is unparalleled in the world. And US companies do make this kind of product, but they are reluctant to produce it long term because they felt this was just a temporary demand. So how did China do it? And I think this is a great research topic. These are just some glimpses, but I think China, first, they centralized coordination of their policies in this National Development and Reform Commission from a specialized ministry. So high level administrative focus. Then they turned to their state-owned oil companies, Sinopec and PetroChina, to make that intermediate melt-blown fabric product. And you can see their scale of totals. And then China turned to its tech firms and said, by the way, you guys also have to go and make face masks. So it's clearly China's a top-down economy, a lot of government control, and they were able to get all of these companies to come in and produce these goods. And to me, this is the most surprising part of the China story. By April, China was back as an exporter. So all the way from January through April, China's exports are very low because China's focusing on domestic demand. But China's ramp-up capability allowed it to be a big export player again. And you can see China's share of world total exports of face masks is predominant. I mean, and again, that's another kind of scale up. How do you go from 0 to 60 or 100 miles per in 10 seconds? That's what China basically does. I'll be really quick on this US case. In the US case, PPE was never a top priority. As we all know now, I mean, the Trump administration was extremely slow, and they didn't even tell people to do social distancing till March. The Defense Production Act is the closest the US has to China's orchestration of production, and it's a pretty clumsy tool, only used in certain wartime situations. Trump's government or administration was mainly focused on vaccines. It had some successes, but also some problems. The ventilator case was interesting because ventilators were considered really a high priority item to save lives. But what happened is once the US used this Defense Production Act and brought in auto companies like GM and Ford to make ventilators, it overshot its mark. The stockpile had been 10,000 ventilators, way below what was needed in April. By mid-August, US stockpile of ventilators was up to 95,000. Only 1,000 of the 95,000 were used. 94,000 are still sitting in the stockpile because ventilator demand fell dramatically because hospitals began to find ways to prevent people from going into intensive care units. So this is the problem of micromanaging the economy. Top producers were these multinationals like 3M and Honeywell, and they basically were willing to go along and ramp up production, but they did say, we're not doing this long term. These aren't profitable for us. If the US government wants to pay us a big amount to do this emergency production, we'll do it. So it'd be interesting to compare China versus US. What do the state-owned companies get back from China, from ramping up production versus these multinationals? But multinationals were very reluctant producers. So the private sector response, I think, was pretty good, slow to start, but eventually ramped up pretty much. But in the end, in some cases, it overshot. The Trump administration, it denied there was a problem. Then there was slow decision-making, lots of misinformation, and then no real distribution strategy. So my conclusion in the US is policy failures were much more important than market failures. Whereas the original critique of the US and these shortages was that the supply chains were too rigid. It was a market failure problem. So last two slides. I just want to say, okay, given those snapshots of some country experiences, China's success and ramp up, US, I think partial success, but ultimately failures in the policy planning that would be needed to do a production partnership with the private sector. Where do we go from here? And I think the real question is, what are these supply chains going to look like post-pandemic? We're not there yet, obviously, because the cases are still escalating. I think there's several obvious options to reduce rigidity and build greater resilience in these supply chains. One is you could make them more domestic. You could bring them back home. That's reshoring and stockpiling. I think that because of what we saw earlier, if these products aren't profitable, US companies aren't going to make them. And so if you're going to build up a stockpile, you have to be really careful. Do you build up the stockpile of masks, or do you build up the stockpile of melt-blown fabric? The intermediate good that's critical. You could also make supply chains shorter, nearshoring, bring things closer to home. And we know from our GVC analysis that regional production networks and regional ecosystems are more prominent in almost every industry than just the global chains. And you can also make supply chains more diversified. If we have a lot of dependence on a few Asian countries, you could also add to those around the world. I think that policymakers had been associating resilience initially with localizing or making supply chains shorter in the US. And I think most people are now saying, again, that's not going to work. Bringing industries back to the US or back to America isn't going to make them stronger. It's actually going to make them more vulnerable. So final slide, if we start looking forward, if we have a crisis like COVID-19, nobody can be prepared for it. The mix of the public health and economic means there's going to be disruptions that have to be adjusted to, and they're going to be massive. So the question is partly, how do you adjust? We've seen some examples from Asia, and other people could talk to other cases. So to me, the questions for the future, and these are questions more than answers about resilience, because I think this is one of our key research topics looking forward, is resilience for whom? Are we talking about resilience for firms where you're interested in risk management? Or are we talking about political goals like bringing jobs back home or increasing manufacturing capabilities? Reshoring does not guarantee resilience or efficiency, but partial reshoring is probably going to be important. But if you're taking an industry like pharmaceuticals, okay, which of those do you reshore? Because technology change is always going so fast that you run the risk of technology lock-in whenever you try to bring a certain kind of technology back home. And that's part of the dilemma when you're dealing with multinationals that are spread around the world. No one country, even their home country, can control them very easily. Then we've got a resilience question about firms versus GVCs. Individual companies have one kind of logic in terms of strategy, but what about when we're talking about the whole supply chain, where we have to look at it from front to beginning to end? I think what is a critical topic here is innovation, of course, and who's controlling, for example, the GVCs for vaccines. And we've seen a lot of international partnerships around vaccine production, especially with regard to China, for example, has a lot of vaccines. Well, who's going to be producing the vaccines to the developing countries? This vaccine nationalism problem. WTO has some ideas. China's got a lot of production capacity. Other countries have ideas. How are we going to handle that? Final point, I think because this has been such a politicized crisis and the global pandemic has gone on so long, security concerns and inward-looking strategies are going to become more important. And that's so politically, you're going to have to show you're doing some things to increase your security. But how do we do that in a GVC-oriented world? I think that's the kind of question that our research community is in a pretty good position to try to answer. So let me stop there.